So my name is David Veale. I am a consultant psychiatrist at the South London Morsey NHS Trust and the Priory Hospitals North London, and a visiting professor at King's College London. And I'm going to talk tonight about getting a good night's sleep, because I'm going to argue that actually sleep hygiene, improving your sleep, is actually a very important part of improving your emotional problems as well. So let's try and share my screen. Oh God, here we go. I knew I was going to do that wrong. Share screen, 1 minute. So hopefully we are going. So I hope someone will shout to me and tell me if you can't see my screen. So as I said, we're going to talk today about getting a good night's sleep, and I believe this should be recorded and put up on the BDD Foundation website later on, and I'll also do a version for my own YouTube channel as well. So, insomnia. What is it? It's difficulty sleeping, and because we're talking tonight mainly to people with other emotional disorders, especially BDD, OCD, depression, PTSD, and so on, you will know it's often regarded as being secondary to the emotional problem. And the reason that is, so it's a symptom of depression, isn't it? So if you have depression, you may classically be waking early in the morning and having repeated wakening at night. If you've got more anxiety, it's classically characterized by difficulties in falling asleep. If you've got lots of compulsions and OCD or BDD, there may be what's called delayed sleep. In other words, you may not be getting to sleep or bed until 2-3 o'clock in the morning because of your compulsions. Things like PTSD, there may be nightmares and wanting to avoid going to sleep. And there are lots of other examples from other emotional problems. But you can see how it's generally regarded as being like a symptom of the primary problem. Now, the consequence, of course, is that you get excessive daytime sleepiness, you're less alert, you're more irritable, you generally have a poorer quality of sleep, and it may be very disruptive in terms of perhaps a delay in when you sleep or going to bed much earlier and so on. So in general, I think you'll find that most mental health practitioners' attitude towards this is, well, we just got to treat the main problem, whether it's the depression or OCD or whatever, and sort of ignore the insomnia. And I'm going to argue tonight that actually we'd do better to try and treat the insomnia concurrently and sort of focus on that as well. Because there's lots of evidence that there's a very circular relationship between the two, between the sleep disturbance and solutions that people adopt and the symptoms of the mental disorder, yeah? And that there is evidence that actually if you, for example, focus on treating the insomnia, you get a significant improvement in your mood. Now, I'm not suggesting you can treat OCD or BDD or PTSD or something just by treating the sleep, but I think it is still an important part of the jigsaw. And in general, if you can get a good night's sleep, then the main problem will improve, or certainly make it easier to resist the compulsions and so on. And you could argue this for a number of other lifestyle problems. If you're eating a crap diet or drinking excessively or not exercising any longer or not connecting with people, of course, all those things are parts of the jigsaw. But obviously the focus of tonight is just focusing on getting a good night's sleep. So a bit of science for you. It's worth understanding the role of melatonin. People think of melatonin as the hormone that comes out at night. Yeah, so you can see here, generally by about 8, 9 o'clock in the evening, it's gradually rising. It peaks at about 1 o'clock in the morning or something, and then gradually reduces again. So it's by the time the sun is out in the morning, it's being suppressed. Yeah, but in general, as the darkness comes, it comes out at night. And the important thing to remember about melatonin is it's not a sedative. It doesn't make you feel sleepy or anything. It's just a signal to the brain, hey, it's time to go to bed, time to sleep. It's just a signal. Yeah, it's not a sedative. Now, what happens, of course, is that people start to develop various solutions to their sleep problem, which then become the problem. And they may then be sleeping during the day. They may be reducing their activity or rest during the day. They're cancelling appointments or social engagements. They're lying in the morning or at weekends, try and catch up, keeping the curtains closed. They might go to sleep earlier, try to sort out their problems in bed, putting off tasks until they feel more rested, all these things. And we will, of course, argue that all these solutions just make it worse. So I'm going to give you 30 rules to stick to improving your sleep. So number 1 out of the 30 is the most important. And that's why I put it number 1, because you're more likely perhaps to remember it. The first and most important thing is stick to a routine. Get up at the same time every day. You know, on average, most people will wake to be ready to get up by 7:30 in the morning. And, you know, always do that regardless of when you went to bed, and then structure your day around that. You can actually do a little questionnaire called if you search on Google on Auto MEQCET, that stands for an Automated Morningness Eveningness Questionnaire, and it's on the Center for Environmental Therapeutics website. You will find the morning eveningness questionnaire in order to determine your natural time of waking. Yeah? In other words, do this for when you would, without your emotional problem, normally be getting up. Yeah. Adolescents, of course, are different, and we're mainly talking today for adults. Adolescents do need longer sleep periods, except we force them to get up to go to school and everything else. The most important thing is perhaps try not to catch up on sleep at weekends or on your days off. You know, if supposing normally you're not working on a Saturday or Sunday, maybe you can have an extra half an hour, but you know, in general, stick to that rule. Get up at the same time each morning. Your body likes routine, yeah, and it really does help to keep your circadian rhythm in going. So when you wake, open the curtains to sunlight. Yeah. If it's still dark, you might like to use a natural dawn simulator to keep you in sync with your internal body clock. So these are 3 I've used in the past. This is one from the Center for Environmental Therapeutics. You can buy on their website, the Dawn Dust Simulator. I think that's from the States. The one in the UK is called Lumi, we use, called the Body Clock Glow. And essentially, the more you pay, the more bells and whistles you get on them in terms of radios and other bits and pieces. But it's very nice to actually wake with sunlight in the morning. And this is another one here, the Philips one. Again, they all differ according to how much you want to spend on them. But natural dawn simulators. And the nice thing also is, of course, in the evenings, it will bring on a nice amber lighting, which is like candlelight, and that's going to help you bring out the melatonin at night as well. Did I just, yes, I did accidentally. Oh my God, what's happened? What happened? I don't know. But never mind. Consider bright light therapy. If you're sleep delayed, or if you're suffering from depression, what I mean by sleep delayed is that, for example, you are going to sleep at about 2, 3 o'clock in the morning and then getting up 7, 8 hours later. It just means your rhythm has all just moved forward. And what you can do, of course, is to use one of these boxes, light boxes, to try and switch off your melatonin in the morning. And they're also useful for treating depression, not just seasonal depression, but also non-seasonal depression. So here you're using a bright light sunlight, which is much brighter than the other boxes I showed you beforehand. This is 10,000 lux, which you use at about a foot away, 30 centimeters, for 30 minutes in the morning. And the time needs to be optimized for your body clock on that auto-MEQ questionnaire. So normally this is something you can sit in front of once you've woken up, 7:30 in the morning, with your breakfast or whatever, where you can actually, you don't want to stare in front of the light, but you can have breakfast, read a paper, whatever it is in front of it, yeah? And the ones I've used are, this is one you can order from the Centre for Environmental Therapeutics, the CET website, to get, at least from the States, that one. The one in the UK we use is the Lumi Brazil. And this one here also is from the States, the Carex Daylight Classic we've used in a trial. So most important things I'm saying to look for is that they are 10,000 lux at 30 centimeters. Yeah, and you don't need enhanced blue light or anything like that. And they should have a perspex screen just to take away any of the ultraviolet lights and things. So not only try and keep to a routine in the morning, but also keep to a routine at night. At least an hour before bed, wind down, you know, do not check your emails or work problems and things. I have to say I'm not always very good at that. Just, you know, do anything to relax, watch TV or a film, read a book, play a game. But you might want to consider using dim amber light, because these are the things that encourage the melatonin to come out. Have a hot bath, shower, go to bed essentially when you feel sleepy, and then sort of stick to that routine. And I mentioned one of the things to consider is using this blue light blocking in the evening. So this is the equivalent of encouraging your melatonin to come out. And so the idea here is to avoid bright light from about 7 p.m. in the evening. Yeah, you can use amber glasses, which are like here down here. These are blue blocking glasses. You can use amber sleep light bulbs, or you can have a bit more light with twilight red light bulbs. All these things will help encourage your melatonin to come out at night and encourage you to tell the brain essentially it's time to go to bed. I've used, as a UK supplier, I've used these people here, blockbluelight.co.uk, and in the USA in the past I've used also somnilight.com. Both of these have got good blue light blocking equipment you can use in the evenings. What about exercise? Well, exercise during the day will make your sleep deeper and longer at night. So again, try to build an exercise program into your structured day. I wouldn't exercise too late in the day. I'd probably leave a couple of hours before bed, because otherwise it could be a little bit too stimulating. But again, try and stick to a routine, as that's going to help your body clock. Napping. Now then, napping. If you nap and you really want to catch up on some lost sleep or something, no longer than 15 minutes, please, if you've been sleep deprived, and by about 3 p.m. Don't nap after 3 p.m. The reason being is that when you wake in the morning, there's a chemical called adenosine that gradually increases as you wake. And the longer you stay awake, the more the adenosine level builds to sleep. So the problem being is that if you nap later in the afternoon, it means much of your adenosine then disappears, so leaving you less sleepy at night. So, I mean, napping can be, for some people, helpful, but I'm just saying keep it short and do it, finish it by 3 p.m. Caffeine. There is a lot of genetic variation because some people are very sensitive to caffeine. And caffeine is a stimulant. It blocks those adenosine receptors, which you need to help you sleep. So for some people, too much caffeine, especially in the evenings, will cause insomnia, a little bit of anxiety. And if you are genetically susceptible, it may be that you can't drink coffee after 2 p.m. I'm not. I can actually drink espressos quite late at night. It doesn't stop me going to sleep. But I'm just saying I'm very aware that for some people, it is a problem, and it might be worth experimenting if you do have insomnia. So espressos are here. You can see the highest amount of caffeine, brewed coffee. Think also about drinks. Red Bull, Diet Coke have got a significant amount of caffeine. It's interesting. Yeah, and Pepsi Cola, Diet Pepsi as well. Nicotine, of course, you get nicotine from cigarettes or e-cigarettes, and people may find that in very low doses it might be a sedative, but it also then becomes a stimulant. This is, people describe this kick. So again, if you can't stop smoking, avoid it in the later part of the evening. You don't want to get it to interfere in your going to sleep times. Other stimulants, of course, it's not helpful to be using amphetamines or cocaine for your mental health, but it is also going to interfere in your sleep. There may be other prescribed medications, things like Ritalin, methylphenidate for ADHD, bronchodilators for asthma. These are the sorts of things you want to try and avoid late afternoon onwards, because they will also be stimulants. Meals and social life. Well, again, do you remember we talked about the importance of sunlight as helping to entrain your melatonin cycle? And but also not only light, your social rhythms, like when you eat around the same time each day, especially at breakfast, the way you structure your day and connect to others socially. Like sunlight, it helps to entrain your own internal body clock. Alcohol. We know that alcohol disrupts the quality of sleep and your memory. And it may be a sedative to begin with, of course, but then it wakes you in the second half of the night, perhaps to urinate or whatever. So, and then you may not be able to get back to sleep. So ideally, you would have your last drink by about 8 p.m., as it takes about an hour to process 1 unit of alcohol. So, there's something, food for thought. Noise. Well, noise is obviously going to wake you. Any unexpected noise in the environment. And if that's a regular problem, consider using earplugs. What about a restless partner? Well, you might want to consider getting a bigger bed, sleep in a separate bed, earplugs, change your partner, all these sorts of things. You want to be able to sleep at night without your partner snoring or being very restless. The other problem, of course, might be a cluttered bedroom. And what we do know is that, if you've got lots of clutter in your rooms, it takes you longer to sleep and have more disturbed sleep. It's not very easy to sleep if your room is like this. Optimum temperature is about 18 degrees centigrade. If it's too stuffy or hot, you might need to open the window. In general, the body temperature needs to drop slightly before you sleep. One way of doing that is taking a shower or bath before bed, and then sort of stepping out of the shower can then help drop your core temperature. So, check your room temperature. And of course, get rid of all those mobile phones, the TVs, iPads and so on, or put them in a different zone in your room. Yeah, they do not help you to wind down, and they're all stimulating. What about cutting out lights? You might want to consider using blackout curtains when you go to sleep, or consider using an eye mask. Again, get something good, which will really help you to switch off the light. Mattress, well, you don't want an old mattress or pillow, or one that's too hard or too soft. So consider thinking about that, turning it around or putting in supporting boards, replacing it, and so on. All these, you want a comfortable mattress. Clock watching. No clock watching, please, or working out how much time you must sleep. Turn away the clocks. Don't check them or look at them during the night, because this increases your preoccupation and strengthens some of your fears and worries that you're not going to get enough sleep and so on. Now, stress. This sounds a bit crass. So look, you're not going to be able to get to sleep very well if you are alert, fully awake, or distressed. And if you are someone who has got lots of compulsions or ruminations, then you probably, with your therapist, want to prioritize those in terms of trying at night, so that you can get a better night's sleep, in terms of trying to do all the standard things for not engaging with the compulsions and trying to spoil them and do the things that you are avoiding. But generally, of course, you can't make yourself go to sleep, and you need to be able to give up those demands that you must have 8 hours sleep or whatever it is, because obviously the more rigid those are, the more difficult it is to get to sleep. Sleep associations. Try to associate your bedroom with sleep, sex, and getting dressed, and not other activities. If you've just got one room, try to zone the bedroom. But all these things, of course, are not helpful for associating with sleep. Watching TV on YouTube, video games, social media, talking on the phone, working, having arguments. You want to declutter and get rid of all these from your bedroom. So there is a 20-minute rule. I would use this only if you, in your own circumstances, if it's been recommended by a therapist or sleep specialist, because it is a very personal thing in terms of the context of your particular problems. As I just said, try to associate the bedroom, sleep, sex, or getting dressed. If you can't sleep or find yourself awake in bed for more than 20 minutes, then the rule is to get up and do something boring with that dim amber lighting. Read a difficult book like War and Peace, anything that is boring and going to make you feel sleepy. Yeah? And then just return to bed when you start feeling sleepy again. Some people have some very rigid beliefs about their sleep, like I must have 8 hours sleep or I can't function. I'm so useless if I can't sleep properly. Unless I sleep well, I'll never recover. I must think of ways to get a good night's sleep. If I can't sleep well, I must rest in other ways. These are clearly unhelpful for you. And clearly you need to be able to discuss with your therapist or sleep specialist, because the problem being is if you hold these very rigidly, then they're going to actually interfere with your sleep. So I'm going to come on to body clock problems, which is strictly not insomnia. It just means everything's been advanced or delayed. So the more common problem is a phase delay. And as I think I already mentioned, this is where perhaps you are delayed in your time when you get to bed every night, and you're only feeling sleepy at 2 or 3 o'clock in the morning, and then you're waking at 11, 12 or whatever. Less commonly, people do a phase advance. That is, they're actually gone to bed by 8 p.m, say, and then they're waking at 4 or 5 p.m, but then they sleep into 8 a.m. So they're actually getting quite long hours in bed. And either of those phase delays or phase advance, of course, may be combined with a disturbed sleep, the sort of problems we've already described in terms of intermittent sleep and so on. Less commonly, you get sleep chaos. So you're sleeping and waking at different times of the day, every day. And that's obviously a very big problem. So what can you do for body clock problems? Well, the most important thing, if you've got a sleep delay and you're getting up late in the morning and going to bed late at night, you stick to that routine. You need to wake up at the same time daily, first thing in the morning. So you do need to get up at 7:30, whatever, on the morning eagerness questionnaire. That's your ideal time, even if you went to sleep at 4 a.m. Yeah, so you're forcing your body clock to go back. And I would then advise using things like sunlight or bright light therapy at that time to switch off the melatonin. And you might want to use amber glasses or lighting in the evening to encourage that melatonin release. So you're trying to force your body clock to bring out the melatonin earlier and to switch off the melatonin at night. And so sort of you can then force your body clock around. Sleep advance is a little bit more complicated because you actually may want to use bright light in the evenings to switch off the melatonin, and that probably needs more therapeutic advice and so on, actually work out whether it is helpful. Because, you know, if you're going to bed at 8 o'clock in the evening, you are probably, your melatonin started to come out at 4 o'clock in the afternoon or something. So that's why I'm saying you need to have some sort of bright light, probably to switch off that melatonin in the evening and try to retrain it. Now, again, I'm a little bit hesitant to talk about worry and rumination here. Of course, particularly when you have OCD or BDD, the aim is not to problem solve or engage with the thoughts at night. And you know, I acknowledge that this is really tricky. This is really difficult, especially at night when you're lying in bed, you're tired. It's more, you know, it's more difficult to disengage from the ruminations. But it's the same principles that you might use during the day. Allow your thoughts and images to pass through your mind without responding to them. Remember, these are ruminations are like rabbit holes, and you can go down these rabbit holes and get really lost in them, and they're very dark and horrible. Sometimes people find it helpful to do a to-do list within about 2 hours before you bed. You write down the worries and tasks that can be solved with dates and times, whether it's going to be tomorrow or the weekend or whatever. So you just know that it's on your list, and you can just gently remind yourself that you don't need to do anything about that now. Remember that worry is an intolerance of uncertainty, and it's almost the not knowing is worse than knowing something bad's going to happen. So again, you really need to structure your day with tasks that are certain, and do the things which is in your control. And there may be things like soothing rhythm breathing, or listening to relaxing music, or natural sounds that can all help you to try to disengage from your worries and ruminations. But look, I'm acknowledging that this is a really tough one to solve, especially at night. Persistent disturbed sleeps. Again, this really needs to be done with a therapist or a sleep specialist's advice. I'm just giving you an idea of some of the things that they might want to, they might try with you. And the key thing here is improving sleep efficiency. So you would be asked to calculate your total sleep time. That's supposing you're keeping a sleep diary, or you've got a wristwatch and everything else that's monitoring you. And it might be a total, should we say, 6 hours or something. You would then also calculate the total time in bed, which might be about 8 hours. And you can then calculate your sleep efficiency. So that would be 6 out of 8 hours, or 75% efficient. And the target is really to go for is about 85% in terms of improving insomnia. So you might, in this case, set an anchor time of when you're going to get up, say at 6 a.m., and a threshold time to go to bed, let's say at 12. So what you're trying to do is to cram those 6 hours sleep between the 12 and the 6 there. And when your sleep efficiency has reached 85% or more, then you would add 15 minutes in the morning. If it's less than 80%, then you would reduce the amount of time in bed by 15 minutes, but you wouldn't obviously go below the minimum of 5 hours sleep. So, this needs to be done with a therapist or sleep specialist's advice, because it really depends upon your particular problems or the context in which it's being used. Just something on medication and other physical problems. Sleeping tablets, well, they're not generally, of course, recommended for more than 1 or 2 weeks during a crisis, because they're easily addictive, and then you just depend on them, and well, all sorts of problems. And the ones that are usually prescribed are the Z drugs, Zopiclone, which lasts about 4 hours, Zolpidem, which lasts only a few hours. Some people still use promethazine, which Phenergan, which is an antihistamine. It does last longer, but it may cause a hangover, a bit of dry mouth and constipation in the long term. Then the old benzodiazepines like nitrazepam, alprazolam with benzo, and Valium, things like that. These are all sleeping tablets which are addictive and not really long-term solutions. So as I said, they are recommended only for use in the short term for a particular crisis. The problem being is that when you stop taking them, you often get rebound insomnia, which may last several few days, in which you get more difficulty sleeping as what we call a rebound. And so this is the effect of being addicted, that it gets worse when you stop it. Reducing the dose gradually can help prevent that sort of rebound, but in general, I would strongly discourage you using any sleeping tablets unless it's a short-term use in a crisis. There are some sedative antidepressants which can be used. Things like trazodone, mirtazapine, nyansarine, trimipramine, amitriptyline. All these are used often in a low dose. I mean, part of the problem here is that some of those, the reason why they are sedative is because they're having that antihistamine effect, like the Phenergan and the sleeping tablet. But they could be used as an antidepressant, or they can be used with an SSRI that's often used, well, it's usually recommended for things like OCD and BDD in combination. But, again, it's not usually a long-term solution to your sleep. What about melatonin? Well, it is, the trade name is called Circadin. It's licensed for adults, so 55 or over for short periods. It's often now prescribed off-label for children. There's not a lot of evidence for it, because you remember I said it's not a sedative, it's just a signal to the brain to say time to go to sleep. It's been shown to reduce sleep, like the time to get off to sleep, and improve total sleep time by about 20 minutes in children with ADHD in 3 small controlled trials. So, I mean, the evidence for it is not that great. And melatonin, of course, you don't actually need a prescription. It's not illegal to possess, so often people buy it online, but then you don't really know about the quality. You shouldn't use it in pregnancy. There's a lot of evidence actually that the doses that people use, sometimes 5 milligrams, 10 milligrams and so on, is actually unnecessary, because that's not what the body uses, and that actually what's called microdosing may be better. But it's not available in that sort of small dose, as far as I'm aware. But there's no money in this sort of thing, so none of the drug companies want to be involved. And there's no studies also comparing them with the, remember I was talking about the amber glasses or the amber lighting in the evenings, because it may be that actually they're just as effective as one another in bringing out more the melatonin if your melatonin is disrupted. You want to make sure that you haven't got obstructive sleep apnea. This is actually quite common, 2% women, 4% men. And the thing to, if you record yourself or your partner, is where you snore in a crescendo, then you pause, you hear a sort of gasp and sudden waking, yeah? And you get daytime tiredness. It's best diagnosed in a sleep laboratory. It's often associated with being overweight, smoking and alcohol use, and so all those things can help to reduce it. If you need it, then you may need treatment by continuous positive airway pressures, which essentially blows the oxygen stuff into you. So look out for that. And actually, the other thing just to check is that restless leg syndrome. And here you're going to may have difficulty getting off to sleep because of that sort of crawling, creeping sensations in the legs and these urges to move. And that's often going to cause frequent interruptions in your sleep and daytime tiredness. It may be secondary to other medical problems or pregnancy, iron deficient anemia, renal failure, so that may need investigating. The main things to treat this is with the sort of sleep hygiene stuff I've been talking about tonight. Quit smoking or exercise. If it's very severe, there are certain drugs that can also help, called dopamine agonists or pregabalin. That is restless legs syndrome. So I'm going to finish there, and I do apologize why my computer suddenly decided to translate my voice into that little text at the bottom. There are many strange things that happen in your computer that I didn't even know I had. But I'm very happy to take questions. And what I believe I need to do is stop screen sharing and go to questions, answers. Right, we got 11 questions and answers already. Oh my God. Okay, so let's have a look. So we've got a question here which says, I'm struggling with severe anxiety when trying to get to sleep. I have many panic attacks where I'm just drifting off, so I've not slept in a bed for 8 weeks. How can I cope with the panic attacks a bit better? At the moment, I'd rather get out some hours sleep on the sofa than none in a full-blown panic attack in bed. Well, I think obviously you asked that question at 7 p.m. So hopefully we've gone through 30 different things you can do today in terms of improving your sleep, and really sticking to a routine, and obviously still trying to treat the panic attacks in a better way as well. But because at the moment I'd rather get some hours sleep on the sofa than none, and a full-blown panic attack in bed. Yeah, but see, the problem is that you get yourself into these solutions which then become the problem, and you get yourself out of sync with the sun, and you just get out of routine. And so it's really important to try all the things we've said today. Someone else has asked, well, how much would the advice for adolescents differ? Would some of this advice still apply? Yes, I think all the advice would apply. It's just that adolescents do need a little bit longer in their sleep. So whereas on average, adults require, say, 7.5 hours sleep, it may be adolescents require 8 to 9 hours sleep. Yeah, so they do need to go to bed a little bit earlier, and or they may be, their natural rhythm is to get up slightly later. But again, the most important thing is sticking to a routine. Yeah, it's not just dogs and babies that need routine, it's adults and adolescents as well. Is it correct that having a hot bath or shower too close to going to bed can act as stimulant rather than support getting sleep? Now, you asked that at 7:16, and I think I probably answered it in that it can help, because what happens, I'm saying, is that as you get out of the bath or shower, it actually is bringing your core temperature down a little bit, and that may help promote sleep. Yeah, so it's not a stimulant, it can be helping to promote sleep. Someone's asked, if I do nap, which is rare, why do I feel terrible afterwards? Well, I think, as I said, the key thing is, if you are going to nap, make it short. Actually, you need to put on the alarm clock, 10-15 minutes, and before 3 p.m. And then I suppose I'd like to know whether you still feel terrible afterwards. That's the key issue. Confused about suggestions to open the curtains to dawn and using blackout curtains. Is this not contradictory? Well, blackout curtains are, of course, may be helpful, particularly in the summer months when it may still be light in the night. And so you want to use blackout curtains in the evenings, but when it is time to get up at 7 or whatever, that's the time you open the curtains and sniff the air and go for a walk or whatever, because actually those bright lights I was talking about, and dawn simulators also, you don't need those when, particularly during the summer months, when you've got plenty of opportunity to bring in the light naturally. Yeah. What about people who work shifts? Oh God. I have to say, shift working is really not good for your circadian rhythm. And there is, I don't know, I don't have on me the reference, but there is a very nice article in the British Medical Journal, which was published about a year or so ago, on advice on how best to cope with shift work. So if you search on Google, it may be a free article, or you may be able to find someone who can get it for you. But if you just search on shift work, British Medical Journal, BMJ, advice, there is some good advice there. But, you know, there's no doubt that shift working can be very disruptive. If you are, especially when it's a sort of few days on, few days off or something, if you're sticking to nights for a significant period of time, then you can adapt to it. You know? But you don't want to do brief things. Is it possible to be frightened to sleep? Well, particularly if you've had PTSD or things like if you get nightmares and flashbacks and so on, or there's something about sleep that you associate or dark with something frightening, it's not surprising if you're going to have panic around that. And so you're going to want to probably avoid sleep. But the problem is, of course, when you start avoiding sleep, you push it all back, and then you get out of sync with the sun, and you then are catching up, and all these other problems then start to roll on. So if sleep is associated with something terrible that's happened in the past, or say nightmares, then it's not surprising. So someone else has asked, oh yes, do you have any advice for stopping after long use sleeping tablets, Zopiclone, 7.5 milligrams? Oh dear. So I would use all the sleep hygiene tips and so on that I've been giving you tonight. 7.5 milligrams, it's something that you can usually cut down to half the tablet, 3.75 milligrams, or halve it. Some people might go down to a quarter of the tablet or something. Or you might try and use it not every night. Yeah. So in general, try to do it slowly. And I think just expect that it's going to be tough to begin with, because you're going to get some what we call rebound insomnia. It's going to be worse to begin with. Stick to all the routines and stick, stuff that I've been talking about tonight. Someone's just asked, why do I feel sick and just awful in the morning before 8 a.m? Is it due to lack of sleep, or could it be too early for my body clock? That is a complicated question, which I don't think it's fair for me to answer, because that needs, I think, a full discussion and understanding of exactly what the problem is and the context in which you're feeling sick and awful in the morning before 8. So I honestly don't know. Next person has asked, can long-term sleep issues over many years be reversed and physical health improve? I don't see why not. It's going to, you're going to need to be disciplined and persistent and really stick to those things that I've been talking about. And be consistent. Yes, be consistent and persistent. Someone else asked, do you know if any anti-seizure drugs have an effect on sleep or make a person sleepy? Yes, sure. I mean, there are some which are more sedative. I mean, things like barbiturates and so on come to mind. And that's obviously, if you are taking such drugs, it's something to talk to the person who prescribes it. And if it's too much of a side effect, it may be possible to switch it to an alternative, which is less sedating. Yeah, particularly if it needs to be used during the day to stop seizures or whatever. Someone's asked, can magnesium supplements help with anxiety and insomnia? I honestly don't know. I mean, if there is a magnesium deficiency, then I guess it probably can, but these are not things that are easily measured. What to do with long-term insomnia, how to solve it? Well, again, unfortunately, that's a question in which requires a more detailed assessment of exactly all the different things that you're doing that may be making your solutions may be making your problem worse. And I said, try and stick to the routines that I've been discussing today, and it may help it. I've got a question saying, I'm a therapist, CBT therapist, working with a person with PTSD, waking up with nightmares several times per night. Any advice? Ooh. Well, I would say that, the most important thing, obviously, in PTSD is helping that individual to emotionally process the trauma, using all the things that we know can help, whether it is helping people to try to differentiate between the original trauma memories and what's happening right now. In other words, updating them. And you can, as you know, use things like stimulus discrimination and imagery rescripting or EMDR. All these sorts of things can help to update them. And the more that you can emotionally process the event, then of course the less the nightmares and the flashbacks during the day. Sometimes people have used a intervention called nightmare rehearsal relief, and that is that they rehearse the nightmare over and over again with a different ending, usually one where you are in control, and you might try and rehearse that before you go to sleep many times, so you just sort of learn it off by heart, and with the ending, which is where you're more in control. And people report that they can actually then dream a different type of ending that doesn't then cause the nightmare. But if you want to look that up, look for rehearsal relief, nightmares. It was done, that sort of work was done actually, I think in the sort of 90s. And I can remember Isaac Marks and others of his colleagues evaluating that, rehearsal relief. Any tips if you're woken by chronic pain? Oh God, from a pain condition randomly at night, or can't fall asleep because of it, and problems getting back to sleep. Yeah, it's not the BDD that affects my falling asleep, so I've learned techniques from BDD treatment. Right. This is really all about learning to manage and tolerate the pain, isn't it? I'm not a specialist in pain management, and that must be really tough if it happens randomly at night, or you can't feel asleep because of it. So I'm going to pass on that one because I don't feel, well, A, I don't feel I know your problems sufficiently, but B, I don't feel I've got sufficient expertise. I think this is something you would need to speak to a pain management specialist, but perhaps towards. What could help when people wake up in the early hours of the morning, like 4 a.m.? Any strategies other than getting up and doing something boring? Yeah. Well, the most important thing, I think, is, would you remember I was talking about improving your sleep efficiency? Because the problem there is that you may then be waking at 4 and not being able to get back to sleep. And so you may have had only, say, 5-6 hours of sleep in total. And you're trying to improve your sleep efficiency by perhaps delaying, therefore, your time you're going to bed, and then hopefully being able to move your clock around. So again, without knowing all your personal details, it's very difficult to know how to advise. Classically, people wake early in the morning when it's associated with depression. And so obviously it's important to treat the depression by all our psychological methods in terms of activating yourself and structuring your day in terms of things that you're avoiding, and making sure that sometimes you might need a sedative, antidepressant, and so on. So all those sorts of things might be helpful. Any recommended books about improving sleep? Yes, I would recommend anything by Colin Espy, Overcoming Insomnia, Sleep Problems. That's in the Robinson series. Colin Espy, E-S-P-I-E, Overcoming Insomnia. Someone has asked, I can only sleep in 1 to 4 hour bursts. Does this matter? I don't know what you mean. I'm not quite sure what you mean by does it matter? Because again, without knowing the full context and whether this is associated with other symptoms or whether it's associated with a sleep phase advance or delay or something, it's very difficult to know. I'm sorry, I don't know if without knowing you more, I don't think I can answer that question in more detail. Next one is, will amber light melatonin help with sleep quality, the frequency of waking, as well as helping to induce sleep? I don't know. I would try it out, but it's primarily helping you to get off to sleep, yeah, because it will help you to wind down and stimulate the melatonin, which is a signal for getting you off to sleep. So it might, but I'm saying it's primarily might be helpful for helping you to get off to sleep, yeah, rather than perhaps the sleep quality and the frequency of waking, yeah. Someone who says, having insomnia for 15 years now and been depending on sleeping pills for years in order to get to sleep. How can I get sleep without depending on sleeping pills? Oh, very sorry. Hopefully, well, by having a plan with your doctor to come off them gradually and sticking to all the things that I've been talking about tonight. All those things will, you have to really stick to them consistently and regularly. Yeah. Would I recommend EMDR, Calm Place for Sleep? I know what EMDR is. I don't know what Calm Place for Sleep is. I'm sorry, I can't comment on that one. Oh, do I have any advice for new parents of a young baby? Oh no. I haven't had a young baby for nearly 35 years. So and bless my wife, she took on a lot of that whilst I was working. So I'm not going to give good advice there. I mean, I think this is all about trying to help your baby to stick to a routine, isn't it? And trying to, but it is one of the worst times in your life. I mean, I remember being a junior doctor, and in my day when we were on call, we were like on call from Friday night all the way up into working on Monday as well, and being woken intermittently. It's just awful, awful experience. It's probably just one of those things. I mean, there is plenty of advice out there on, I think, on helping your baby to sleep consistently, but there will be times when it is really tough. So I do understand. The reason I take seizure drugs is I had a brain hemorrhage for a seizure in May and a brain coiling operation. I was wondering if it's the tablets or just effects of the brain hemorrhage that makes me tired and have disturbed sleep. Now, I'm afraid I really can't answer that. This is something you must discuss with your neurologist and GP, because this is obviously quite a complex area. I mean, my gut reaction is I wouldn't say it's the effects of the brain hemorrhage that still makes you tired and have disturbed sleep. But, you know, I'm honestly not an expert in this area. And I think this is something you must discuss with a neurologist. Is it still effective to use a 10,000 lux lamp late in the morning? Well, it is not as effective. If you really want to use it for depression and to switch off your melatonin in the morning and so on, no, you must use it first thing in the morning. There is a little bit of controversy in the field about using such lights in bipolar disorder. Some people argue, and trials from America, that if you're going to use it for bipolar depression, that it is safer to use it a little bit later in the day and a lower wattages, a lower brightness. But that is, not everybody would agree with that. In general, I'm saying for most things, you would still use it first thing in the morning and really optimize the timing. Any other advice for sleep issues in menopausal, postmenopausal women? Oh God. Yeah, because obviously one of the issues in the menopause is that it often a symptom of the menopause when your sleep may be disturbed. So I think you've got to do everything that you can, that you probably already know about how to minimize those symptoms in terms of diet and other supplements. And I think it's just going to take a little time to overcome, as well as, of course, all the things that I've been talking about tonight. Oh God, someone here, would microdosing mushrooms improve sleep? Taking in the morning 0.3 milligrams every 4 days. I couldn't possibly say. I don't, you know, I am interested in magic mushrooms as a research tool to investigate whether it could be used as a treatment for depression and OCD, BDD, and so on. I don't think there's any need or necessity to be using microdosing, it's, you know, the magic mushrooms and other psychedelics have been, there's some evidence for its use, one-off trips, as it were, and it's not something you would be taking over and over again. Someone says, I understand you shouldn't nap, but if you struggled with sleep for a long time, you only get 2 hours of sleep, perhaps around 6 a.m., how can you cope in a day with just one 15-minute nap? Well, it is tough, but I'm saying that you need to consistently get up in the morning with your sun light at 7:30 or whatever's the optimum time for you, and really stick to that routine. And over time, it will gradually improve, because you need to think about long-term solutions rather than the short-term solutions. Yeah. Someone says the dream completion technique may be worth a try. It's on YouTube. Oh, well, if it's on YouTube, then it must be good. As I said, in the literature, scientific literature, it's called rehearsal relief. Someone says, I stop feeling sleepy when I go to bed, even when I'm feeling tired. Why is this happening? Oh dear, I'm not sure what to say to that one. It sounds like you're getting more alert for whatever reason when you go to bed and shut your eyes. So honestly, without a more detailed history and really understanding the context for that, or whether you're starting to ruminate or worry or something else is going on, I honestly don't know. Someone says, I'm a teacher and I struggle to switch off from work. I think about work a lot, and I know my colleagues experience the same thing. Yeah. So this is really tricky, isn't it? So I think that you particularly need to have a time to wind down in the evening. 2 hours before bed, you really shouldn't be doing emails, marking, working. I don't know if you do that now. It sounds like you are, someone who's worrying or thinking a lot in your head. And so anything you can do, whether it's dim amber lighting, things to help you relax in the evenings. It may be that you need to, 2 hours beforehand, make a list of tasks that you need to do. Try to always do, make that list of things you're actually going to do in terms of a thing, rather than an action, rather than something that you want to worry about. Yeah, because this is all about tolerating uncertainty, because there are many things in this world, including the things you're doing at school, which you just don't know about. And the problem, of course, with worry is that you're trying to solve problems that don't yet exist and trying to get yourself more certainty and control over the situation. Of course, it doesn't work. All it does is just create more doubts, more worries. And so that's why it's really important to get help, I think, for that process of worry and overthinking, yeah, which is rarely helpful. Someone has lastly asked, is it better to get up at 7ish rather than 8:30 turned? Not quite sure. If you complete that questionnaire, the auto MEQ on the Centre for Environmental Therapeutics website, CET, then it will give you a sort of optimum time for getting up. And that's the time I'm saying to try to stick with. And so if it comes out around 7, that's the time you get up with, yeah? Right. Oh God, I got more questions. I have a high blood pressure and I go to bed, my heartbeat whooshing through my head. I'm on meds for it. Is lack of sleep, 1 to 4 hours, going to cause a heart attack or a stroke? I think this is very unlikely. Yes, you want to optimize your sleep for your mental health, but it's not going to be sufficient to cause a heart attack. So, you're being very sensible, you're trying to keep your blood pressure down, and I'm sure there's lots you can do, and I'm sure you don't smoke, and you want to be able to exercise more and keep active and have a healthy diet, all these sorts of things, all of which will help you. Maybe you lose weight, I don't know. All those things are far more likely to help you to improve your morbidity and so on from having a heart attack or a stroke. Right, it is 8:07. My God, we've gone on. I'm going to close the Q&A. I'm hoping that Nicole is going to come and rescue me. Nicole, are you there?
I'm here. Thank you ever so much, Professor Veale, and thank you to everyone for coming along this evening.
Great.
Goodbye. Good evening.
All right. Goodbye.